The overall goal of today's webinar is to try and provide you with a bit of an overview of socially connected or group-based physical activity, and hopefully make the case for both explaining what it is, but also the benefits and utility of it and why we should consider engaging in socially connected physical activity. And what I'll also look to try and do towards the end is provide some examples from a range of different settings in terms of how we can make use of socially connected physical activity to serve our various needs and goals and so on. So in terms of, let's see if we can get this slide to move forward, just bear with me. Okay, I think we've got that. So in terms of physical inactivity and some of its consequences, these are really quite well known, and I'll not provide an extensive overview of the epidemiology around inactivity. But what we can take as a given is that physical inactivity has increased alarmingly across the globe over the past century. It's also a major cause of premature mortality and is associated with a number of preventable health-related conditions in relation to cardiovascular disease, functional capacity, cognitive function, arthritis, and indeed quality of life. And indeed, physical activity has been identified as an important factor in contributing to successful aging. So the primary focus of the talk will be around physical activity in relation to older adults, but I'll also provide some complementary examples from other settings as well. It's particularly germane to think about physical activity in the current pandemic context as well. I'm mindful that the slide on the right might be a little small when you're looking at this on a computer, but what we can see across every single demographic in relation to age, ethnicity, household income, living situation, is that, so these are data published in the Journal of the American Medical Association based on data collected in April, so early stages of the pandemic when compared to age-matched controls 2 years earlier in 2018. And what we see is this heightened level of psychological distress, and this is amongst a sample of over 35,000 adults. And so given the links between physical activity and also mental health, it also is particularly timely to think about engaging in physical activity in the current pandemic context. And I'll talk a little bit about some of the work we've been doing over the last 8 months in the current pandemic. Okay, so why groups? So we'll start off with a maybe a bit of a historical basis, but we'll start with Charles Darwin and his famous work on the origins of species, who wrote that with those animals which were benefited by living in close association, the individuals which took the greatest pleasure in society would best escape various dangers, while those that cared least for their comrades and lived solitary would perish in greater numbers. So scientists and researchers have been talking about the importance of groups and social connectivity for quite some time. And indeed, from an evolutionary psychology perspective, I know these are not some of my graduate students, but perhaps they may as well be, is what we see is that group living is a fundamental aspect of human evolution. Those humans that were successful in seeking out and maintaining group support survived to reproduce, and the unsuccessful or those who were naturally solitary were phased out. So indeed, from an evolutionary psychology perspective, there's certainly compelling evidence that points to the importance of groups. So how about groups and physical activity? What's the evidence around the benefits of engaging in group-based or social physical activity? So I'll provide you with some of the empirical evidence, some of the data that points to this. So what I'm going to show on this slide here, and I try to make sure that the webinar is not too data heavy, but I think people also appreciate, what is the evidence around these things? So this is the results of a meta-analysis. And if you're not aware of what this term is, so a meta-analysis pulls all the studies conducted in a given area, and they look to derive what's called an overall effect size. So as a point of comparison to understand what these numbers point to, is that 0.2 and above is a small effect, 0.5 is a medium effect, and 0.8 and above is a large effect. So this is a really prominent meta-analysis that was conducted in the mid-90s by Bert Karen and his colleagues at the University of Western Ontario. And so what they found was this. In terms of comparison with those with exercising with others versus alone, there was the exercise with others tended to stick with it to a greater extent than when people did these exercise classes or programs on their own. When they also engaged in socially cohesive classes, those folks tended to stick with those classes to a larger extent than those that weren't cohesive, and those that were task cohesive, so those groups were united around the task activities, and they tended to be much more adherent to those sorts of programs. So when we take all of this together, is that groups, and in particular cohesive groups, tend to derive improved levels of adherence relative to certainly exercising on one's own. In terms of the data with regard to older adults, so this is data reported in The Lancet, the prominent medical journal, and this represents surveillance data collected in major World Health Organization regions. And what I direct your attention to in particular are those blue bars. And what we see here is that across every single major region and continent across the globe, older adults tend to be the least active cohort in society. Those data are particularly, it's become particularly concerning when we look at objective measures. So the data in the figure at the top are based on self-report, where people tend to overinflate how active they are. So when we use objective measures, so through devices called accelerometers, which we can wear on the hip or on the waist, what we see in Canada when using the Canadian Health Measures Survey is that less than 15% of older adults currently meet international physical activity guidelines. And if you're not aware of those guidelines, that they correspond to engaging in 150 minutes or more of moderate to vigorous intensity physical activity.